Hello, everyone. Good afternoon, and welcome to this fall series of community conversations by UW Medicine. We have our distinguished panelists today, and today's topic is the latest COVID vaccines, the bivalent vaccines, the flu vaccines, and where we are with regards to the pandemic and the variants. So Dr. Margaret Green is joining us today. She is assistant professor in the Department of Allergy and Infectious Disease at UW Medicine. Dr. Green's expertise is infectious disease and public health. Thank you so much, Dr. Green, for joining us.
Thanks for inviting me back.
Thank you very much. And we also have Dr. Alex Taylor. Dr. Taylor is a pediatrician at UW Medicine Shoreline. He specializes in pediatric and adolescent health. Dr. Taylor is passionate about community outreach and engagement. Thank you again, Dr. Taylor, for joining us. Thank you for your time today. We also have Callie Hunter from the Department of Healthcare Equity. Thank you, Callie, for organizing this town hall today.
Thank you. Excited to be with you all.
So with the fall here, we are officially in the cough and cold season. With the COVID in the mix, really we should talk about today how to keep ourselves and our kids safe. And I think today's conversation will shed a lot of light on the current COVID situation and the vaccines. Dr. Green, let's start by talking about what viral infections you are seeing out there right now causing upper respiratory infections. Can you please talk about what we are seeing at this time?
Certainly, we're actually surprised. We're already starting to see some influenza A. There's still, RSV that's being reported. So some of our typical respiratory viruses, and then of course, COVID-19 with the most of our, at least the data that we're getting from our lab indicate there's still of the BA4 and BA5 Omicron variant. So really starting to see a mix of all things coming together.
Thank you, Dr. Green. Dr. Taylor, what are we seeing in kids, and how is the smoke impacting upper respiratory symptoms?
Yeah, we are seeing, or I am seeing in the clinic, all the same things that Dr. Green mentioned. I have had patients that I have swabbed positive for flu and COVID, and had patients who were swabbed at the ER and came back positive for RSV and have had bronchiolitis. So those are all around. Seeing a lot of hand, foot, mouth as well in the last few weeks as kids go back to school. So just all the regular viruses are back and very prevalent, along with still some COVID that is definitely not going away. The smoke seems to be an ongoing issue. Seems like we desperately need rain. That, at least from what I've seen, has been a bigger problem for my patients who have asthma. I've seen a number of kids who have not had exacerbations in the last 2 years coming in with asthma exacerbations following up from being in the ER. And that could be a combination of both the smoke and then seeing these viruses again that classically exacerbate asthma. I think flu and RSV are probably worse than COVID for that, for most kids. And so we're seeing more asthma exacerbations. I think any kid who has had asthma that hasn't had an issue in the last couple of years, it's probably a good time for them to see their doctor and check in and think about, do I need to change up what I've been doing, because it's likely to be an issue again.
I think that's a really important point with the smoke mixing into the picture. Upper respiratory illnesses, especially asthma, can, we are seeing that exacerbated in people. So it's a very good idea to actually look at your inhalers, if they are expired or not, and to get them refilled, and also especially for kids to see their pediatrician. Dr. Green, with the masks, coming off, what are you seeing in terms of epidemiologically, in terms of COVID cases, and especially with the fall and other respiratory illnesses? Where are we in terms of the pandemic and in terms of cases in our area?
Well, I think, we are coming out of a lull is how I see it, that our low over the summer was really a nice reprieve. And I'm, certainly we're no way close to where we were at the beginning of the pandemic. I don't want to be an alarmist. We're in a much better place. But yes, we are starting to see cases uptick, and it's a little trickier now because we know that all of our numbers are reflected from these PCR-based tests results that we know that antigen testing is far more frequent right now, and we don't get those reported in. So I've hear of a lot more frequent people home testing and staying positive. So I think we are seeing an increase in cases over the last few weeks. And I know also the King County Public Health was having some difficulties with some of their data management. So even the numbers that are on there, they've said, they're fixing the problem, but may not be reflective of what's going on. So as people, as we expected, as everyone predicted, kids going back to school, back on the school buses. We're so happy that there's more school buses around now, but it does mean that there's a lot more transmission. And, we are seeing some increase in our hospitalizations as well, coming down the road.
Thank you for that. Dr. Taylor, as Dr. Green mentioned, schools are, back open now, and that would mean more transmission, but not necessarily more reporting. So it is very likely that, some of the cases or most of the cases, they are not reported because people are doing home testing. So Dr. Taylor, especially in kids, is Omicron still the more predominant COVID strain or variant that you are seeing?
Yeah, seems like at least in our community right now, that is still the very predominant variant of COVID that we are seeing right now. Honestly, for kids, it hasn't seemed to make that big of a difference what we see in terms of symptoms. Kids have throughout the pandemic often been asymptomatic. So there's still a number of asymptomatic infections amongst kids, which is probably going to make it tougher to prevent spread in schools as kids are back. And then the majority of kids have very mild symptoms. And so it looks a lot like our other colds, those other viruses we talked about. Maybe some fever, some congestion, some cough, some sore throat. And that's going to be most of what parents will see from kids when they're sick with COVID, which of course sounds like just about every other illness that kids are getting right now. So I do think that parents being ready to be able to test their kids when they do inevitably come home with these colds is an important thing to prepare in advance. And probably being ready to test kids at least a couple times while they have symptoms, because with the newer variants, sometimes our at-home antigen tests are just not quite as good at picking up the virus in the first few days. So a lot of things to be thinking about. It does not seem like things are necessarily getting any easier from a parent's perspective, even though kids are back in school, just because of the challenge of identifying COVID amongst other infections.
So it would be fair to say that if your kid is not feeling well, to start off by a home antigen test, and if negative with still suspicious symptoms, to get in touch with their pediatrician to get tested. I will take a question from the Q&A. Dr. Green, is there a way to report a positive antigen rapid home test?
I was just looking that up. I'm not sure. I don't know how they would get recorded. So I will look as we talk to try to figure that out. But I haven't seen it. I don't know if you know offhand.
I think that possibly calling King County Public Health and reporting it, I think, would be the best option for that. Dr. Green, let's talk about our new bivalent COVID vaccines. And even though they've been there for a few weeks now, but we still have people hesitant to get it, and they have lots of questions. People have lots of questions in the community. What is this vaccine to start off with? What does it contain and what does it protect against?
Sure. So it's based on the same technology as the other COVID, vaccines. It just includes antigens that are more focused on the BA4 and BA5 Omicron variants. So we know that the Omicron variant was a little bit able to escape the immune system, to evade the immune system, and we saw, more transmission because of that. And so this was a sort of redesign of the vaccines that we've been currently giving to millions of people to try to better get more antibodies against those strains, because those are the dominant strains. Or in fact, I'm sorry, I misspoke. It was mostly based on BA1. And I think that was one of the concerns, is that, but by the time they made the vaccine, the BA4 and BA5 had kind of taken over. So that, I think, it still provides good immunity. We've seen at least from blood tests that we see that people do develop good antibody levels from this new vaccine.
And Dr. Green, how is this vaccine different, or why is it, or people think that it's more potent? Why is it so important to get this vaccine, even for people who have had their booster, their fourth booster? Why is it so important to get this?
It's really because of that kind of evasion of Omicron from the other vaccine, that we really didn't get good neutralizing antibodies from the initial vaccine against Omicron. And so we really want to, boost people's immunity to what's more likely to be circulating going forward. And that's even if you had Omicron, right? We know that the immunity from natural infection does not last very long. So if you got caught up in the Omicron wave this spring, that immunity that you developed from there is going to wane, and getting that booster will help to protect you and our community during this fall season, as we all eventually head inside or maybe stay inside because the smoke has kept us indoors more.
So I think that, it's really important for people to know that this vaccine is different from the previous booster, because it is protecting them against the Omicron, and it will also prevent, especially for people who are more vulnerable or who have underlying, lung infections or other chronic illnesses. This vaccine will be very protective for them. And it's important for people to get this vaccine to prevent community transmission. Dr. Taylor, the vaccine is now approved for 5 to 11-year-olds as well. Can you please talk about what you are seeing in your practice? And I know it just got approved, so it's probably not, people have not even started, getting it yet. But when do you think it will be available for folks? And what kind of side effects do you expect with this vaccine?
So yeah, absolutely. I think it was just Wednesday of this week that the FDA and the CDC agreed that it was appropriate to extend the emergency use approval of the bivalent vaccines, both Pfizer and Moderna, down to the 5 to 11-year-old age group for the Pfizer, and for Moderna, it's actually 6 and above. And so I have not given any of those out yet. I'm kind of waiting to make sure that we get the UW approval, that we're good to give those out in this age group. Just like the older adults and bigger kids, the 12 to 17-year-olds, we are not supposed to be doing any boosters with the original monovalent vaccine. If we are doing even just a third dose of a booster, it should be this bivalent vaccine from now on. So what I have seen from the CDC and the FDA in their review of the evidence is they expect the side effects, which we will get more information on as we use it more, to be the same as with the monovalent vaccine. They don't expect things to look different at all. And so kids in general seem to have handled those vaccines better than adults do. So we see a little bit less fevers, less achiness, less just fatigue for a day, but those are all symptoms that are potentially on the table, and certainly appropriate to manage. So as whenever I talk about vaccines of any type, I talk about certainly taking Tylenol or taking ibuprofen if your child is miserable for that next 24-hour period, because there's no reason not to manage those symptoms. Yeah.
I think a very important point that Dr. Taylor mentioned is that any booster that people will receive now is the new bivalent booster. So that's very important for people to know that we are no longer, getting the monovalent boosters as we were a few months ago. Dr. Green, there's a question in the chat. I got COVID about a month ago. I'm still in recovering stage. Is it safe to have a flu shot and a booster shot now? I had my first booster in April, May. I read since I had COVID recently, I should wait to take the booster in 3 to 4 months. Also, are those post-COVID symptoms? Well, we'll probably talk about post-COVID next week, but what would you recommend for people who are just recently recovering from COVID?
Yeah. So the CDC, their wording on this is really, I think, a little bit vague, and I think leads to a lot of confusion. But basically, the idea is that from your natural infection, you probably have some immunity, and so you may want to wait 3 months before getting your next booster, so as not to kind of muddy your symptoms. If you're already feeling tired, there's no urgency to get that booster within the first 3 months, unless there's another, special need for it. But it is actually safe to give it, and it's certainly safe and probably really important to get your flu vaccine. So for me, if I were in that situation, weighing that we expect the rates of infection to start going up because of the fall months, and seeing the modeling that's coming from our colleagues about, the infections, what you're weighing is whether you might feel more tired for a few days in relation to your vaccine versus, risk getting a respiratory virus infection or not getting your vaccine in time to rebuild your defenses before you might get exposed again. So it's safe to give immediately after an infection, but it's okay to wait if you're still having symptoms. The flu vaccine is completely separate, although because you do want to protect yourself from flu. And I know that many people do have some vaccine side effects from the flu vaccine, the similar fatigue, joint pains, and those are temporary. And as Dr. Taylor said, can be managed usually with Tylenol or ibuprofen.
So I think thanks for clearing this misconception up, Dr. Green. There's often, people feel that they should not get the vaccine for 3 months, even if they are feeling okay. And so there's absolutely no contraindication. You can get the vaccine if you are feeling fine.
I think that also developed when vaccines were more in short supply too, that we knew that people who had just been infected would be protected for a little while. And we really wanted to focus on prioritizing those people who had no immunity. And so that's another understandable reason how that message has gotten out there. But now, if you're feeling well, there's no reason to wait.
And on this note, Dr. Green, can you please talk about the vaccine, the bivalent vaccine? Is UW actively giving out these bivalent vaccines? How can people make, get those vaccines at UW, locations?
They are. In fact, I know that there's one outside of my office. So every time I go out the door, there's a line of people waiting to get their vaccines. So yes, we have started, and some of the community vaccination sites have been busy trying to prioritize getting patients scheduled. You can go onto UW Medicine website and search, COVID vaccine and get a vaccine that way. And the other way is also through our retail pharmacies, who also are giving out the bivalent vaccines, and those appointments can be found on the WA Vaccine Finder website. And I know a lot of people have gotten good, easy, vaccines through that as well.
And most of the clinics, the UW neighborhood clinics, offer the vaccines. They may be temporarily out of stock in some clinics, but we are offering these vaccinations at the neighborhood clinic locations as well. Dr. Taylor, do you expect that the vaccine will be the vaccine for kids? How soon do you think will it be available at our clinics?
It's a good question, and I'm not exactly sure when we will have that new bivalent vaccine available for kids. I would assume that it will happen quickly, as it happened for adults within just a week or two of being approved. So that's my expectation. I think it is important for families to be paying attention to any messages they're getting from UW from their primary clinic about when that's available, as hopefully we'll be sending out that information of when kids can be scheduled as well.
And then Dr. Taylor, for kids, would you, in terms of getting the vaccine after a recent COVID infection, would you say the same thing? Is it okay for them to get the vaccine?
Yes, after their initial symptoms have resolved, they're out of their 10-day period of quarantine, it is certainly fine to start getting the vaccine. I think especially for those youngest kids who a lot have not gotten even their primary series of the vaccine, I would encourage them to just definitely come in right away as soon as you can after kids have been sick, even to get the vaccine so that you can boost the protection you're getting, even more beyond what you get from having an infection. For the bigger kids who maybe have had their primary series, the 5 to 11-year-olds or 12 to 17-year-olds who may have even had 3 vaccines already, I think it's a little more reasonable to not necessarily rush in, as Dr. Green was saying. The difference, the benefit that you're going to get from that additional dose is smaller than you got from getting that additional primary series. So I think for those, could be reasonable to wait for 3 months while it's convenient for you.
Thank you. Dr. Green, talking about mixing and, of the vaccines in terms of the booster, people who have had Pfizer or Moderna, can they mix it up with a different bivalent booster? Now, is that okay?
Yes, it's okay. It's safe. And we have data from the prior studies with people who mix and match, and there's not a recommendation to mix and match. So what I generally tell people is just to get whatever one is most convenient for you to get of those bivalent boosters, whether it's Moderna or Pfizer. Whether it's, if it turns out the pharmacy that you want to go to doesn't have one or the other is perfectly safe to get.
And Dr. Green, is there any extra benefit for people to mix these vaccines up?
Not that we've seen. Certainly, if we're only talking about the mRNA vaccines, not the J&J, because we do know that people who had a primary series with J&J should be boosted with the mRNA viruses. But between the mRNA viruses that we have, the Moderna and the Pfizer, we don't see that there's a strong benefit either way.
Dr. Taylor, do you expect that this vaccine would become an annual feature? That will people need more boosters, or do we know at this time?
It's a good question, and I'd be interested to hear what Dr. Green has to say on that as well, as someone who maybe has even more information than I do. It certainly seems like that's how it has shaped up thus far in the 2 years since we first got the vaccine, that we're getting one about each year and trying to cover the things that are most prevalent that year. So starting to look similar to flu. I think what we need to see evidence of is, are we helping ourselves by continuing to get vaccines? Are we just adding a little bit of temporary immunity from getting infection at all? Or are we really changing the balance of severe infections by getting an additional dose each year. And maybe we don't need one every year to continue to protect ourselves from severe infections that we're really worried about. But I don't think we have that evidence quite yet.
I also know that there's a considerable amount of energy trying to go into developing a universal COVID vaccine. So one that wouldn't have to be changed annually like our influenza vaccine. So I think if that is, and you know, this is all in development, but if we get that, then we just have to figure out how often we need to boost that immunity. And again, weighing that about what we're gaining by having that increased immunity. So too soon to tell, but at least for the next few years, I would anticipate that we'll be getting more boosters, that this isn't the last one. Sorry.
Dr. Green, let's talk a little bit about the flu vaccine. You mentioned that you already are seeing influenza A. How important is it for folks to not put off their flu vaccine? And can they get their vaccine along with the COVID booster?
Yes, it's critically important. And I think particularly, you know, for young kids too, because we really haven't seen a lot of flu activity in the last few years with everyone being masked and socially distanced. And now that has changed. And so we are expecting a rough year from influenza. Remember that before, you know, COVID-19, we saw, you know, thousands of people die every year from influenza, mostly older people, but, you know, really serious illness. So we've always considered it a serious disease, one for which we wanted people to get vaccinated for. And I think that we're expecting this year to be a rough influenza year. So I encourage everyone to get their flu vaccine soon as they can, and that it's perfectly safe to give it at the same time as your COVID booster. I don't think we had our flu vaccines at the University of Washington yet when I got my booster, but I would have done that to save my arm, you know, another day of being sore. And it's certainly what I plan for my 5-year-old, who will hopefully be able to get her booster soon. And flu vaccine at the same time.
So it's really very important for people to know that flu could be, you know, it could be a rough year this year for influenza. And now with the masks coming off, the transmission will actually, we will see robust transmission. So it is very important to, you know, to protect ourselves. Dr. Taylor, what would you say about kids and their flu vaccine? And should parents be waiting, you know, to get into the winter and get them their vaccine, or should they be getting it now?
Yeah, I appreciate that opportunity to echo what Dr. Green is saying, because I think that's probably the most important thing to take away from this today. Is definitely important to get your flu shot this year, and great to start now. We are already seeing flu. I have tested kids positive for flu in my clinic. So it is absolutely around, and with the big changes from our behavior in the last couple of years, it's really hard to predict when we're going to see the big spike of flu. And so it could be, you know, much earlier than usual, and getting your flu vaccine now to get great protection for the next few months is a great idea. In the last couple of years, I know our numbers for flu vaccination have gone way down, at least in kids. I'm assuming it's true for the whole community, but definitely true for kids. And so that's going to be a big multiplier for the tough flu season we're expecting if we also don't act and get more flu vaccines again this year. So I think that's, again, the most important thing for parents to take away from my portion of this discussion is to go and get the flu shot, because I think otherwise we're going to have a really tough flu season, and would love to be proved wrong because everyone got their flu shot and there were no issues.
We really appreciate this word of caution, Dr. Taylor, and it's so important for parents to know that with COVID and flu in the mix, kids can also get the two infections together. And I think that would be especially very, very tough for kids with asthma or reactive airways. So it's really important to protect our kids as much as we can. Dr. Taylor, is there a way for parents to distinguish is this, apart from testing, is this flu or is this COVID? Is there a way that parents can distinguish that symptomatically?
I don't think there is a good way, unfortunately. I think testing really has to be the way to know. Those infections, especially to doctors and other providers in the clinics who are seeing them multiple times a day, may look a little bit different, but even we are still wrong when we try to make guesses as to what's going on. So you can look for those signs like loss of smell and loss of taste that seem to be particular to COVID, but I have tested kids with that and they have come back negative and positive for something else. So there is nothing that I've seen that is, you can be sure that this is COVID or you can be sure that it is not. So being ready to test your kids when they come home with colds and bringing them into the clinic if you're still suspicious based on who they've been exposed to or the symptoms they had, so that we can test them with a PCR test that'll be even more accurate, I think is the right way to go for anything you're seeing that looks suspicious. That being said, the management for most infections with flu, most infections with COVID and most other viruses is going to be the same for kids. You're just going to keep them comfortable. Tylenol, ibuprofen, if they have high fevers and they're feeling really uncomfortable, muscle aches, joint pains, headaches, things like that, you're going to give them lots of fluids and you're just going to let them rest. Yeah.
And then, Dr. Taylor, we are able to test for both COVID and the flu with the nasal swabs at the same time, right?
Yes. We can do those together, minimize the discomfort of the swab by doing those right at the same time. So it's a great way to figure out, do we have anything that we really should be worried about all at once?
Thank you. Dr. Green, should we expect more variants of COVID-19 to emerge, in the near future?
Yes, there are always the variants of interest that are circulating, and I think we're already starting to see some in the UK that are kind of being watched. So this will just continue along the path that how viruses evolve. And so far, they have gone in the pattern of becoming more virulent, so easier to transmit and pass on, and in general, a little less severe in their illness. So that has been helpful. Omicron was a little less severe than Delta virus, et cetera, but I hope it stays that way. But yes, we should definitely continue to watch, and our scientists are watching, everyone is watching these variants of concern. When we get a COVID infection, they don't test, our lab doesn't test our sample necessarily. We don't get to find out what variant we have, but on a community level, they are doing this testing on a certain percent of the positive cases. And so we have within our community a knowledge of what the circulating variants are.
So, Dr. Green, there's a follow-up question in the Q&A about the booster, and they would like to know, how long does the booster provide immunity? Can we say for sure how long we are immune after the booster?
Yeah, we really can't say for sure. Even the studies that look at the neutralizing antibodies, that's just one marker of infection, but or of protection, but it's not a direct correlation. So I think the question is, if you have COVID in mid-September, is there a strategic benefit in waiting a few months before getting your booster? Probably, if you're following your COVID immunity that closely, there might be a reason to wait, to 2 months. I wouldn't want to risk getting COVID again. And so I'd probably, I wouldn't push it too far, is what I would say. But, definitely still get the flu shot now. I hope that helps answer the question.
It does. Thank you. Dr. Taylor, while we are on the topic of vaccines, would you like to talk to parents about the other childhood vaccines which kids are missing, or the vaccines which are, tend to be ignored, especially over the past couple of years? How important is it for parents to keep up on that vaccine schedule, especially for younger kids?
Yeah, I think that's a really good point. With a lot of missed visits in the last couple of years for understandable reasons, worried about coming into the clinic when you're healthy and potentially being exposed to COVID, we have missed some opportunities to keep kids up to date on the usual vaccines that we do just for all kids as they grow. And so there are a number of things that I think with our regular viruses coming back, we may see more of our regular bacterial pneumonias and things like that that show up usually as a secondary infection to colds and things like that take that opportunity to cause trouble. And so coming in to get immunizations for things like pneumococcal, one of the bacteria that we worry about causing pneumonias frequently in kids, as well as everything else, there's a lot of things that have continued to be an issue throughout the pandemic, things like tetanus. If you have a cut, you're always at risk, whether you've been around others or not. Polio, I'm sure everyone has heard stories about polio spreading, even in the Eastern United States recently. And so keeping your kids protected so that they can help to protect everyone else in the community as well is more important now than ever, I think, because of those missed opportunities in the pandemic. And that should be easy for anyone to do. Just go in and have a regular wellness visit with your pediatrician, and they should very quickly be able to bring kids up to date on everything they need. And those vaccines can be given at the same time as the COVID vaccine and the flu vaccine. So I am trying for kids who are coming in and are due for all of them. We're usually just doing them all together and making sure that we take those opportunities to, again, keep kids up to date.
I think it's really important for parents to remember to not miss their usual vaccine schedule for any reason, for the pandemic or, for any reason. And that they could get vaccines together along with the flu or the COVID vaccines as well. Dr. Taylor, there's another question that we have from the community. Do we know what the potential long-term effects of the vaccine would be on babies, little babies? And do babies who were preterm need to take any extra precautions?
So I'll start at the end there. Babies who are preterm, those are babies who are even more at risk. So they're much more likely to have chronic lung disease associated with being preterm. And so getting them their flu shots and the COVID vaccine when they get to 6 months old and are eligible is even more important, or at least as important as the rest of our kids. And we do not need to wait until they get to 6 months from their estimated due date. It's just 6 months from when they were born and they are eligible. So that's for those preterm kiddos. In general, and sorry, can you remind me of the first half of that question?
So the first half was, do we know the potential long-term effects of the vaccines on babies? Right.
And so we do have a fairly short time course where many kids, millions of kids have received these vaccines. So far, it seems like it has been extremely safe, even compared to older kids and adults. Again, they have less symptoms when they first get the vaccine. We've seen less of those more worrisome side effects like the myocarditis that we saw in young adults. We are not seeing that with like any frequency in the kids less than 5 years old, which is extremely reassuring. In general, the expectation would be that if there was a long-term consequence of a vaccine, it would be because of something that happened in the first 6 weeks, 3 months right afterwards, that then caused issues for that kid down the line. So I do think even our short amount of data is really helpful for knowing that that vaccine will be safe for those kids in the future. And then that is just added on to all our information about all the vaccines that we give and their safety for use and safety for the rest of the lives of those children.
Thank you. Dr. Green, I have a question from the community. How safe do you think it is to travel? I will be moving from Seattle to Tennessee and I will be taking a road trip. I'm 72, I have asthma and reactive airways. Nevertheless, I'm eager to see my son and my grandkids. I always mask and social distance. So how safe is traveling in general? And just going off of this question, what would you advise people regarding travel in the fall and winter, and also about masking?
Yeah, thank you for that question. It sounds like that person is due for a visit and also really taking a lot of precautions to protect themselves. So that's great. I saw my mother for the first time in 3 years, just a month ago. So I get that a lot of us have delayed travel and are anxious to see our loved ones. I would say that we've known for a long time that air travel is a very easy and efficient way to spread respiratory viruses. So when I'm traveling, if I'm going to travel with my family, we are going to be masked in the airport. We're going to be masked on the plane as much as possible. They are young kids, so they have to have snacks every 5 minutes. But and we're going to be washing our hands frequently. And that's what I feel I need to keep us as safe as possible. But I think, that we have seen a lot of masks coming off in indoor crowded spaces. And I think that we know that that's a really, efficient way for viruses to spread. So I think there are ways to travel safely, and there are things you can do to mitigate that risk. I do recommend people still travel, especially if they're going to visit, vulnerable adults. Try to bring some COVID antigen tests with you so you can, self-test or make sure that they're somewhere where you are going so that you can kind of self-test and isolate or quarantine if needed.
Thank you. I think this is a great point to be able to, carry some tests with you. I think this is really, really important. Dr. Taylor, there's a question from the community about breakthrough infection in kids. And I believe that they mean kids who have had the vaccine and getting COVID after that. What has your experience been with these children? Are they, are they able to get over the infection quicker? How severe is the sickness in them?
Yeah, so certainly we are seeing infections for kids who have gotten the vaccine similar to adults. Seems like there's some really great immunity for a few months after the vaccine. And then after that, you certainly can still have COVID infection, but it seems like the vaccine is still very effective at preventing serious consequences of those infections, which is the most important thing. And that's what we really are hoping to get out of our vaccines, right? It's nice to not have to worry about getting COVID infection at all, but knowing that even if you do run into COVID infection, that you are well protected is a nice thing after getting the vaccine. It's hard to say whether those infections are necessarily shorter, at least from my anecdotal data in the clinic. It seems like most of the time when I see kids who have had COVID, that it's usually a pretty mild infection. And most of my patients have gotten the vaccine, at least in the 5 to 11 and up group of patients. And so I am encouraged that they are having very minimal infections. One of the things that I actually just learned from talk about the vaccines and COVID sequelae is that the inflammatory syndrome, MIS-C, that was noted soon after COVID first arrived in the US, is less common for kids who have gotten the COVID vaccine. So that is decreased by getting the vaccine.
So the vaccines are really important, especially to prevent the MIS-C. I think, that really goes a long way in speaking about the importance of getting the vaccines, and especially this bivalent vaccine. Dr. Green, a common question that we hear from the community is the nerve pain, the local pain, arm pain from getting the vaccine. And some people have had this for a little more than expected, a little more time period than expected. What has your experience been with that nerve pain, which is a local side effect from the vaccine?
For most people, it seems to last just a few days, and I have seen it last up to a few weeks, and generally getting better over time. With anything, there's going to be a bell curve distribution of, there probably will be people with even longer, but for the most people, it's just a handful of days, and much of it can be handled with, over-the-counter pain medications.
Thank you. Dr. Taylor, with the Halloween around the corner, can you please talk about how, folks can have a safe Halloween and how kids can go trick-or-treating safely?
Yeah, I certainly encourage trick-or-treating and getting dressed up for Halloween, and hope to be giving some candy out myself. In terms of staying safe, I think it is great to have hand sanitizer with you when you're out on the road going trick-or-treating, just so you can wash your hands after you've been to each house. Do a little sanitizing is a great way to make sure that you're not catching anything. Again, not just COVID, but all the other viruses that we are seeing around in the community right now. And then I think the risk is also very low. So in those short interactions you're going to have at someone's door, that is usually not enough time to share a respiratory virus. And most things we know that COVID is not usually transmitted on objects. So like candy wrappers and things like that. Those are pretty safe. And so I would urge everyone to enjoy their Halloween to the fullest and just use a little hand sanitizer to be on the extra safe side. Curious if Dr. Green has any other recommendations. It sounds like she has some potential trick-or-treaters.
I do. They are very excited. They're very excited. And I think we just generally keep our pack of trick-or-treaters small, so that the kids, once they're together, it's not 20 kids, running all together in a ball, trying to minimize the number of different people that they're exposed to, that they're roaming the neighborhood with for longer periods of time.
So I think these are such, valuable pointers towards a safe Halloween. Dr. Green, what would you say about indoor gatherings now that it's getting colder or it will get colder and people will be gathering indoors without a mask? What would you say about people who are a little bit more vulnerable in terms of their medical history? And also with Thanksgiving coming up, people are going to be meeting family and friends. What would you say about that?
I think the ability to, we have so many more tests available now. So I certainly think in the way we handle this in my family is still minimizing the number of different families or interactions we're having in a given week. I always try to think of, if I wake up with a sore throat tomorrow, how many people am I going to have to call to let them know? And I want that number to be as small as possible, right? So I try to keep our indoor unmasked social encounters, just infrequent enough so that if something pops up, it's just not a big deal. Thanksgiving is a hard one. We like those big dinners and to be together, all together. And we've needed that so much, that connection. So I think a lot of people are planning to have people do a few tests, right? Especially for asymptomatic people, it's good to do, 2 tests at least 24 hours apart so that you can try to catch some of these asymptomatic infections before you gather.
I think frequent testing, like you mentioned, is so very important to keep our loved ones safe. And also, I love the other point that you made is to take the tests along when you are traveling. So I think that we can all safely enjoy Halloween and Thanksgiving and Christmas. I think we are reaching the end of our town hall today, but I would like to touch upon a very important information that we have, which is in-home vaccination is available for folks, for people 6 months of age and older. And these are people who are eligible for the primary series or the booster series or the booster dose and have an injury or developmental disability, medical or mental health condition that makes it difficult to leave home. And Callie will be putting this information in the chat. We have this service available through King County, Pierce County, and Snohomish County. We also have this for folks who are outside of these counties. There are phone numbers that Callie will be putting into the chat, as well as there is a link for people to click on, and they could make appointments if they are outside of these counties. So, so you have this information in the chat that Callie put in with phone numbers as well. And so there's an online form for home-based vaccination of people who are outside of the King, Pierce, and Snohomish counties. And then there are 4 numbers for these 3 counties. So people who cannot step out of their home because of some disability or limitation, they can reach out and see if they would be eligible to receive vaccines at home. Thank you very much, Dr. Green and Dr. Taylor, for giving us time today and for such valuable information and tips for the fall. Thank you very much for giving us information about vaccination. We really appreciate your time, and we will see you next time. Thank you very much.
Thank you for having me.
Bye-bye.
Bye.
Thank you.